Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Posterior Decompression of Chiari Malformation. Introduction. Chiari malformation is a condition that could cause dangerous weakness of the arms and legs, decreased sensation, as well as bladder problems. Sometimes your doctor will recommend an operation to correct this malformation. The operation is known as posterior-fossa-craniectomy and decompression. The decision whether or not to have this surgery is yours. This patient education module will help you understand the condition as well as the benefits and risks of this surgery. Anatomy. The brain has two main components. First, the cerebrum is the biggest component and is located in the upper part of the skull. It is very important for thinking, speaking, seeing, understanding, and initiating movement. Second, the cerebellum is much smaller. It is very important for balance and coordination. It is located in the lower part of the skull in an area known as the posterior fossa. The spinal cord relays orders from the brain to the rest of the body. It also allows the brain to feel different sensations, such as pain, temperature, and touch. The cerebrum, cerebellum, and spinal cord are connected by the brainstem. The brain, including the cerebrum and cerebellum and the spinal cord, are surrounded by a clear fluid that acts as a shock absorber. This fluid is known as cerebrospinal fluid, or CSF, shown in blue in the illustration. The brain, spinal cord, and CSF are covered by a membrane known as dura. This membrane protects the brain and spinal cord and prevents the fluid from leaking. Symptoms and their causes. At birth, some people are born with a posterior fossa too small to house all of the cerebellum. Therefore, part of the cerebellum hangs down in the upper neck through the bottom opening of the skull. That opening is known as the foramen magnum. This results in the Chiari malformation, named after the physician who first described this condition. The protruding cerebellum may put pressure on the brainstem or spinal cord. This is known as brainstem or spinal cord compression. For some people, this protrusion of the cerebellum may cause severe headaches in the back part of the head. It could also cause weakness, paralysis, numbness, and problems with the bowels or bladder. Even though the Chiari malformation usually occurs at birth, some signs may not show up until adulthood, if ever. In some people with Chiari malformation, the compression of the spinal cord may cause fluid to accumulate inside the spinal cord, a condition known as syrinx. A syrinx can cause weakness and a decrease in sensation. Chiari malformation is best diagnosed using an MRI. An MRI is a test that shows structures inside the body. An MRI can show the exact location of the end of the cerebellum. This MRI shows a Chiari malformation. The arrow points to where the cerebellum should end in a posterior fossa of normal size. The bottom arrow points to where the cerebellum ends in this example of Chiari malformation. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. In mild cases of Chiari malformation, surgery is not needed. Medications may relieve the headache. If patients have severe weakness, changes in sensation, or severe headaches that do not respond to medications, surgery may be needed. The objectives of the operation are to prevent any further damage and possibly reduce the headaches and weakness. Procedure. The aim of this operation is to relieve the pressure from the spinal cord and brainstem by making the posterior fossa and upper spinal canal slightly bigger. This is called decompression of the spinal cord and brainstem. The operation is known as posterior fossa craniectomy and decompression. As mentioned, posterior fossa is the name of the base of the skull housing the cerebellum. Craniectomy means taking bone out from the skull. Decompression means releasing the pressure. This operation is done under general anesthesia. The patient is placed on the operating room table face down with the neck flexed. The hair of the back part of the head and neck is then clipped and cleaned. The incision is then taken down to the back part of the skull and the spine. A small piece of bone is then removed from the lowest part of the skull. A bone may also be taken from the back of the vertebrae of the neck. The dura is then opened up. An extra surgical step may be needed if a syrinx or fluid buildup inside the spinal cord is present. To drain the syrinx, a small tube shown in red here is placed to connect the inner part of the cerebellum to the surroundings of the spinal cord. This will divert the fluid and stop it from being forced inside the spinal cord. The opening that connects the surrounding fluid to the center of the spinal cord may be plugged with a small piece of muscle shown here in blue. Part of the cerebellum may also be taken out surgically if deemed necessary. This usually does not result in any new symptoms. At the end of the operation, your surgeon may choose not to close the dura or may alternatively decide to put a patch to widen the space covering the cerebellum. Both techniques have generally similar results. The patch for widening the space covering the cerebellum can come from different sources. It is usually taken from the covering of the neck muscles. Other patches are synthetic or taken from a deceased donor. You can ask your doctor about the origin of the patch he or she uses. The bone removed from the skull or the vertebra does not usually need to be replaced. At the end of the operation, the muscle and the skin at the incision site are sutured or stitched together. Risks and complications. The surgery is relatively safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attack, stroke, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is extremely important to let your doctors know if any of these symptoms occur. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Deep infections may involve the spinal cord, brain, or the fluid that circulates around the spinal cord and brain. This is known as meningitis. Treating deep infections may require long-term antibiotics and possibly another operation. 2. Bleeding, either during or after the operation. This, in extremely rare cases, may necessitate a blood transfusion and the possibility of another operation to remove the blood clots. 3. Skin scars that may be painful or ugly. Other risks and complications are related specifically to Chiari malformation surgery. These are also very rare. However, it is important to know about them. Strokes, paralysis, weakness, swallowing problems, and death are very rare but possible. CSF, the fluid that surrounds the spinal cord, may leak under the skin and even to the outside. Another operation may be needed to repair this fluid leak. A CSF leak can also cause headache, nausea, and vomiting every time the patient sits up and elevates his or her head. Be sure to tell your doctor if you notice these signs after the operation. After the operation. After the operation, you may be asked to lie flat for a few days to allow the dura, patch, or muscle covering the cerebellum and spinal cord to heal properly and prevent fluid leaks. The nurses will check the function of your arms and legs repeatedly to make sure you are recovering and not getting worse. Heavy lifting, bending, or twisting is usually not allowed in the first few weeks after surgery. Physical therapy may be needed after the operation to help you strengthen your muscles. Depending on how much physical therapy is needed after the operation, patients may stay from a few days to a few weeks in the hospital or in an extended care facility. It may take a long time to recover from the weakness and symptoms that were present before the operation or that have occurred since. It is therefore very important for patients to follow a strict physical therapy program to help them become stronger. You should be sure to call your doctor if you develop any severe headache, fever, new weakness, or fluid leak from the incision. All these may be signs of serious complications. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Chiari malformation is a condition that could cause dangerous weakness of the arms and legs as well as bladder problems. An operation to fix this malformation is usually successful in preventing more severe symptoms. An operation may even help in improving some of the symptoms. This operation is relatively safe. Risks and complications are not frequent. Knowing about them will help you detect and treat them early if they happen. Thank you for using Explain.